Welcome, everybody. Today, employer sponsored healthcare is the only industry where purchasers spend billions per day yet do not judge their performance by how good their purchases were. Greetings, everyone, and welcome to the show. I'm John Clay, your chief strategist and host for this live stream, Benefits with John Clay. Quick shout out to our sponsor. Today's show is sponsored by none other than Better Source Benefits, Benefits Option Solutions. Check it out at www.bettersourcebenefits.com. So let me read that again because I had to make this note because it makes no sense, but yet it happens every day. Employer sponsored healthcare is the only industry where purchasers spend billions per day yet do not judge their performance by how good their purchases were. Stop it. Healthcare needs less risk management and more supply chain management. And when a business spends a significant amount of money also known as a capital expense, they have departments and tools and dedicated teams to evaluate all of these purchases. The teams in these departments make sure that investments are competitively priced, efficiently delivered, and paid correctly. And what's more is they want to make sure that they demand high quality out of these purchases. Healthcare should be viewed the same way. Therefore, we've talked about it before, healthcare should be viewed as a capital expense, CapEx, instead of an operational expense, OpEx, which you can't do a whole lot about. An exception to this practice is the only way you can really tackle some of the largest line items on your P&L. So, back to what we said on the kickoff, employer-sponsored healthcare is the only industry where purchasers spend billions per day and don't look at how good their purchases were. Instead, what they typically see and what people have cultivated over the years to do is they provide a framework from insurance, typically designed by brokers and insurance companies, that help evaluate purchasing of these big, huge health plans. And it's a spreadsheet in many cases. And this framework focuses on aggregate metrics and built to estimate future costs rather than more actionable measures on the effectiveness of these expenditures. Plan sponsors and their consultants focus on risk management when they probably should be focused more on supply chain management. Supply chain management has the tool set the industry needs to create a better and more efficient healthcare system. If you look at any supply chain, the concept is anything that does not add value is considered waste and has to be eliminated. So in healthcare, the days of business as usual are over. And you know me, I'm always talking about change, change, adapt, or die. And here we go again, around the world, every healthcare system is struggling with rising costs, uneven quality, despite the hard work of well-intentioned, well-trained clinicians. Healthcare leaders and policymakers have tried countless incremental fixes, attacking fraud, waste, and abuse, reducing errors, enforcing practice guidelines, making patients better consumers. Everybody knows about high deductible plans. Hey, we'll make you a better consumer, right? Electronic medical records, that's going to move the needle somehow, but none have had much impact. And it's time for a fundamentally new strategy. And here's a novel idea, folks. Let's focus on this concept: maximizing value for patients. What a concept. And we're talking about better healthcare outcomes with less risk at a lower price, very simply, in 10 words or less. How are we going to do it? Well, we have to move away from the supply driven healthcare system that's organized around physicians and toward a patient centered system organized around what patients need. A couple of points here. We shift focus from the volume and profitability of services provided, physician visits, hospitalizations, procedures, testing, and we get away from that to demand best patient outcomes. And we replace today's fragmented system, because we've got folks all over the place, from a wondering generality to a stated specific, demanding best patient outcomes. And the case in point here is today nearly every local provider offers a full range of services. If we have a special situation or particular medical condition, those services are concentrated in health delivery organizations and locations to deliver high value care. Now, you've heard me talk about change, adapt, or die. Well, here we go again. Making this transformation is not a single step, but an overarching strategy. We call it the value agenda, and it will require restructuring how this healthcare model is delivered and organized, measured, and reimbursed. And in 2006, Michael Porter and Elizabeth Teisberg introduced the value agenda in their book, Redefining Healthcare. Since then, through research and the work of thousands of care clinicians and leaders and academic researchers around the world, the tools to implement this agenda have come forward. And they're developed and they're in demand now by employers, advisors, providers, and other organizations. And they're rapidly spreading and gaining acceptance because the providers see there's no sustainable path forward. And they're embracing some of these strategies and solutions because they actually get a chance to practice medicine instead of working for the paperwork and not focused on patient outcomes. So, great news. The transformation to value-based healthcare is well underway. Some organizations are still at the stage of pilots and initiatives. That's okay. And those focus on individual practice areas. Other organizations, for example, the Cleveland Clinic, Germany's Schön Clinic, have undertaken large-scale changes involving multiple components of value and fitting right into our narrative today about the value agenda. The results, believe it or not, have delivered striking improvements in the outcomes and efficiency and growth in market share. Imagine that, a better performing health system that actually improves the quality of care and drives value not only for the patient, but for the providers. With this body of work, there's no doubt about how much the increase in the value of care can impact an organization like yours. The question is, which organizations will lead the way and how quickly can others follow? There's a big learning curve here, and you need to partner up with the right folks because these changes and these solutions are up and ready to go. So a special note here, the challenge of becoming a value-based organization should not be underestimated. There is a lot of money at stake here. We have entrenched interests from practices of many decades, and this transformation must come from market demand and willingness to improve from within. Physicians and provider organizations, they can build interdependent steps needed to improve value. And because ultimately value is determined by how medicine is practiced. Yet every other stakeholder in the healthcare system has a role to play. Patients, health plans, employers, and suppliers can hasten the transformation. If you've got a willing partner, it makes it a whole lot easier to deliver the value that we're talking about here on the value agenda. And everyone will greatly benefit from these changes. So how do we define the goal? What is the goal here? So we take the first step, and that's to define this goal. Efforts to reform have been hobbled by the lack of clarity about the goal, or even the pursuit of the wrong goal. Improving access to care, containing costs, boosting profits, those have all been a big distraction. And, those access to poor care is not the objective, nor is it reducing the cost at the expense of quality. Increasing profits is today misaligned with the interests of patients, though, because the profits depend on increasing the volume of services, not delivering good results. So as we've reduced the cost, we've demanded more volume to make up that difference, and care has suffered. I don't think you find anyone out there that will deny that patient care has suffered because of the high volume requirements. So for step one, my definition must be improving value for patients, where value is defined as the health outcomes that are achieved to matter to patients relative to the cost of achieving those outcomes. Improving value requires either improving one or more outcomes without raising costs, or lowering costs without compromising outcomes, or both. And we see that on our centers of excellence. High quality, lower cost facilities and procedures for some of the large ticket items out here. Well, failure to improve means, failure. The challenge of embracing a goal of value at the senior management and board levels requires a fundamental departure from the past, because the value agenda demands a different set of objectives. When you think about what we're setting as a goal, right? Very simply, we want improved value for the patients. Well, how are you going to deliver better value for the patients? Well, here we go, because while health care organizations have never been against improving outcomes, their central focus has been on growing volumes and maintaining margins. Despite noble mission statements, where there's no margin, there's no mission. And the real work of improving the value is left undone. And the healthcare delivery and payment structures have remained largely unchanged for decades. Fee for service. These you pay us ahead of time, and then we'll cover whatever you need. And at the end of the time, there's no settlement, there's no true up. You pay us money, and then we'll charge you a renewal fee. Antiquated at best, and very profitable for a lot of partners that will fall into that BUCA category, for example. These outdated and underperforming systems have reinforced the problem and produced this system we're talking about that delivers erratic quality and unsustainable cost. Yet they work nicely for the stockholders and private equity players in healthcare. All this is now changing. We're starting to see the worm turn a little bit because the pressure is starting to build. And the pressure comes in the form of expectations to contain cost. The payers are aggressively reducing reimbursements, and finally moving away from the fee-for-service model toward performance-based reimbursement. And in the U.S., we're looking at the increased percentage of patients being covered by Medicare and Medicaid, which reimburse at a fraction of the private plan levels. So government legislative pressures are leading more independent hospitals and physicians to join health systems and move out of a private practice and become, how many people have had their doctor sell out and become a salaried employee of a hospital system? That's all been legislated into these reforms. And so that's what we have left, is that the transition will neither be linear or swift, but we're entering a prolonged period where providers will work under multiple payment models with varying exposure to risk. So let's talk about the value agenda and take a look at this graphic here just a minute. So you've got 6 main components to a high value healthcare delivery system. They are interdependent and mutually reinforcing. You've got organization into integrated practice units. You've got measurable outcomes and costs for every patient. You've got bundled payments for care cycles, and you integrate delivery across separate facilities while expanding excellent services across a geography. And then down there at the bottom, it may be cut off, but we're trying to build an enabling information technology platform, which ties all of this together in this model and creates the value proposition that we're talking about here today. Very key components because they all integrate together. Because if you look at this, the prior model doesn't address many of these components, and the current structure just rests on its own set of mutually reinforcing elements, profitable for everyone, including the government, but the patient suffers under medical debt and collection agency threats. All right. So I invite you to click on our website and see how effective the value agenda is for some of my case studies at www.bettersourcebenefits.com. And if you want, click on the Get Started link to book a brief web meeting with me, John Clay, your host and chief strategy guide. So the big push. What we have to get out there is that we now have the framework, knowledge, and data to push for change. We've got to verify the claims of those in trying to engage with it. We've got to collaboratively refine and join these efforts. Okay, we've got to get more people involved to work through these issues. And the main thing is that we've got to ensure that it's an appealing experience for members. We call that noise, and we want to minimize the noise. You know, I talked with a prospective client the other day, and they said, yes, we've made some changes here with minimal disruption. Well, managed disruption versus minimal disruption means that you must have a communicated and clear message that's repeatable. We just had a session last week called a retellability, so that people are clear and understand that when you issue a new program to them that has a value-based appeal, that there's the appropriate communication that goes out with them so that they don't feel like they're the lost ball in high weeds trying to figure out what this card means. You've got to have a retellable story. You've got to identify the problem and create a takeaway, typically in a brochure, that will tell them what to expect, how to manage through, and the compelling reasons why we're focused on their best interest and their best outcome with this medical plan. Big stuff, change, adapt, or die. But hey, that's what we're talking about, and all facets of stop managing the healthcare and demand this value agenda. Because the value agenda is where we're headed, and we're proud to be able to be part of that ecosystem that is bringing vendors and employers together to deliver the best possible outcomes for employees. So that's it for today. I hope this has been informative and gives you the confidence to go out there and demand the value agenda and your employee benefits program going forward. So join us next week, same time, 2 p.m. Eastern, on Benefits with John Clay, and we'll see you then.